My fingers on the posterior aspect of C1 on the transverse processes, and I'm just lifting toward the ceiling. Okay? Shouldn't be any symptoms or excessive mobility. I mean, there's going to be a little mobility because you're like pushing into a ligament. It's not going to be like a hard end feel. But you know, she shouldn't feel nauseated, anything weird like that. There's patients that if you just even palpate anywhere in the suboccipitals, they get symptoms. And so you have to be able to differentiate that. Is this a trigger point referral kind of thing, or some cervicogenic kind of thing? Or is it transverse ligament instability? All right, so now looking at fracture of the ring of C1 or the dens, what I'm going to do is I'm going to, on the transverse process on the right here of C1, I'm going to do this kind of key grip. If this is C1, I'm going to kind of be on the sides of it. And I'm just going to push it laterally. Okay? Because if everything's intact and I'm pushing on C1, it's just going to be a butting up against the dens and nothing's going to be happening. If either C1 vertebrae or the dens of C2 is fractured, you know, it's not going to feel good or it's going to move. So I'm going to stabilize C2 on the left and I'm going to push C1 on the right. Okay, so again, I'm going to find the transverse process of C2, block it, find C1 on the right, and just do like a counter pressure shear thing. So I'm just blocking C2 on C1, you kind of know my